Alrighty, guys. So this is a pharmacology lecture. So this is in Unit 27 of your Pharmacology for Medical Assisting book. This is medications that affect the nervous system. So this is a pretty short lecture, and then you'll have a couple of assignments attached to it that need to be done. Analgesics. So analgesics are medications that relieve pain without loss of consciousness. So think of things that may make you a little bit sleepy sometimes, but not necessarily something that will knock you out like an anesthetic, right? So these are things like opiates. These are a natural and synthetic drug that are derived from morphine. So things like codeine, dilaudid, oxycodone. And then we have opioids, which are synthetic drugs not related to morphine that mimic the morphine's action or the action of morphine. Okay. And then we have narcotics. So, an analgesic is something that works on the central nervous system, and it may produce dependency. So there is a likelihood that or a chance, I guess, that somebody may become dependent on the narcotics or addicted to them. It may cause respiratory depression. So, pretty safe to use, but may need to be reminded like when they sleep that it can cause respiratory depression, and they must follow controlled substance laws. And then we have an antagonist. So these are things like naloxone. Okay, so these prevent or reverse the effects of opioids, and they're given intravenously, subcutaneously, or intramuscularly. Okay. So analgesic, antipyretic. So an analgesia that helps to relieve pain. An antipyretic reduces fever. An anti-inflammatory helps to reduce inflammation. So examples of these are codeine, Percocet, ibuprofen, naproxen. Naproxen is things like Aleve, right? And then we have sedatives and hypnotics. So a sedative has a calming effect. A hypnotic helps to induce sleep. So benzodiazepines, these are commonly used to treat anxiety. They help reduce early wakening. They increase total sleep time. The action or onset of action is about 15 to 40 minutes after you take it, and they last, or the duration of them are about 6 to 8 hours. And there is some potential for dependency. And then we have Parkinsonian drugs. So Parkinson's disease is that imbalance of the neurotransmitters, and that acetylcholine and dopamine in the brain. So palliative relief of that is what we're trying to do is um, treat, right, the the symptoms of it. So bradykinesia, so that's like slow movement, rigidity, tremors, poor equilibrium or poor balance, and then poor posture. So examples that might be given are things like Simitrel, Parladel, and cogenitin. And then Alzheimer's disease. So this is caused by deposits of an amyloid plaque between brain cells. Begins usually after the age of 60, but there is definitely earlier cases of Alzheimer's disease or early onset Alzheimer's, and it is incurable. So symptoms of this is mood changes, disorientation and confusion, memory loss, so a tendency to misplace things, and then impaired equilibrium or dizziness, so a personality change. So treatment of this are cholinesterase inhibitors, antipsychotics, antidepressants, and NMDA receptor antagonists. And then we have an anticonvulsant. So this helps with things like epilepsy, seizures, that type of thing. So epilepsy is an abnormal electrical charge in the brain. The treatment objective of that is the greatest control of seizures with the least side effects, right? And it definitely is individualized. What works for one person may not work for another. Types of seizures, we have the partial, which is a focal seizure, generalized, which is bilateral, and then unilateral. So generalized meaning bilateral is on both sides of the body, unilateral is on one side. So they may be put on things like Klonopin, Keppra, those types of things that are anticonvulsants. Then we have anesthetics. So these interfere with the conduction of nerve impulses, and they produce a loss of sensation. They cause muscle relaxation and or loss of consciousness. So think of like when you go into surgery, right? You get put under anesthesia. So general, this is a loss of consciousness, and then so that's like when you go into surgery, right? So you're asleep for the whole thing, and then you can also have a local anesthetic. So this is loss of sensation in a specific area. So examples of these are Marcaine, Lidocaine, and Novocaine. So a local would be like if you go to the dentist and you have to get a filling, right? They're going to give you a local anesthetic. So they're going to numb one area. And then we have ophthalmic drugs. So these are used for glaucoma and mydriasis. So these are used, we'll kind of talk about these a few different times. They can be used for diagnostic examinations, maybe if you have to have an eye surgery. If kiddos get pink eye, that helps with infection, right? And then maybe if you have inflammation for whatever reason. So drugs used in vertigo, motion sickness, and vomiting. So vertigo is used to describe the illusion of movement. So if you close your eyes and you get real dizzy, sometimes you may have a spell of vertigo. Motion sickness is usually associated with travel. So like seasickness or car sickness, right? I have to drive because I get car sick if not. And then vomiting is usually a symptom of an underlying cause like a stomach bug or something like that, right? So the things that you can take for that, a lot of people take, maybe you've heard of like Dramamine, that type of thing. It's something to help kind of stop that motion sickness or that seasickness or that dizzying, right? So we'll talk about that quite a bit more as we move forward in other sections. So, all right, there's a couple of different assignments attached to this lecture. So get those done and hope everybody's good. Have a good night. Bye.